Now what we're going to talk about is how to get the Prokera ready so that you're ready just to install it into the patient's eye. So when you're getting the Prokera, typically what happens, I'll show you what the technicians do. They have this set up here this is on a tray here. And we have the saline that we're going to use to rinse out. That's what we're going to talk about over and over again. That's the most important part. And what we have is we actually have our technicians come in and they actually open up the box. So when you're opening up the box is going to have a few things. So we have the box, and this is the package that has the Prokera Slim. When you are opening this is what we tell all of our technicians, is when you're opening, it says open here, so it makes it quite nice. When you're opening this, you don't want to rip it out because the Prokera could go flying out. What you want to do is you want to slowly open this, kind of just go back and forth from each side. There is how the Prokera is placed when we walk into the room. Now we're ready to go, so I come in, wash the hands. First thing I do is put gloves on. And when we're putting the gloves on here, what I'm looking at is just to make sure I have a spot to where I can, an area where you can rinse off the Prokera. Some people like to do it over the sink, some people like to do it over a tray like this. I put a cup here on this just to show you that, some people like to rinse it over a cup. So what I do is I come in here and I like to open it just a little bit more. So we have now here the Prokera Slim, and you have the preservatives here. Remember, it's preserved with Cipro and an antifungal too, amphotericin B, and also glycerol. And so really what you want to do is, if you were just to take this Prokera and put it in the eye, it would burn the patient. And so it would sting, it would be uncomfortable. So what I do is just kind of get all of that off. And so here what we're going to do is I put a little bit of saline through there. You can actually kind of see that coming out, the preservative there. I'm rinsing through up top here and letting it just come out onto this mat, rinsing through the little hole there. I'm going to rinse this out as much as I can. So what I like to do is give it a good rinse still while it's in here. You're going to lift this up here, and then this is the Prokera. In this case, this is a Prokera Slim. And now this Prokera Slim, what I do is I take it out and I want to rinse it some more. The biggest part of you're watching any of these videos is like rinse, rinse, rinse again. Some people like to rinse over a little cup to make it easier, but really you're just rinsing as much as you can. You want to rinse along here, along the ring. You want to flip it over, rinse there. You can even adjust your grip just to make sure you're rinsing as much as possible. The reason I really like the Prokera Slim is because you can actually see the amniotic membrane. It's actually wrapped over and it makes it much more comfortable in these patients. So now once you've rinsed it all, now you have the amniotic membrane here, the Prokera Slim that we have here, and now you're ready to place it into the eye. So what I like to do is kind of just eye it out with the tape to see how much tape we'll need. You don't want to make it too thick where the eyelashes are like completely covered, but you want to get it just enough to where that can sit on the skin there. Once you're able to get the lower edge of this Prokera, then it's just going to come right out as you're able to hold the upper eyelid and as the patient looks down. Just so you know what else is in the box after we prepared it, put it in the patient's eyes. So in here you have a few things. Number one, you have the DRI card. It already has a sticker there, so you just put the patient information there and then you send that to BioTissue. I like to put one of these on our charts, these little stickers, so we can track. And then the other thing that you have on here is the product insert. So if you wanted to look on how to insert it and how to take away, obviously these videos will help, but you have some pictures there if you want to remind yourself one more time. So that's what's in the Prokera. You got the Prokera Slim, the DRI card, and the product insert.